It was meant to be a mild variant of COVID, but just in the last few days, Omicron has spread like a contagion, especially in the United Kingdom and across Europe. That's right, Omicron now threatens the global order, and India too can't be immune for much longer. How is and how ought the world to respond? We're back with the Global Roundtable, the Omicron Global Doctors Roundtable. Hello and welcome. And let me introduce our guests on the Global Doctors Roundtable. Dr. K. Srinath Reddy is President, Public Health Foundation of India. Dr. Shankara Chetty is medical practitioner. Dr. Manish Gautam is respiratory consultant based in the United Kingdom. And Dr. Rahul Pandit is member Maharashtra COVID-19 Task Force. But first, before we come to all our guests, take a look at how Omicron has now spooked large parts, particularly of the Western world.
Omicron is driving a new COVID wave in many parts of the world. The United Kingdom is the latest epicenter. It registered a record number of daily coronavirus cases, second day in a row at 88,376 on Thursday. Less than a month since it was detected, the Omicron now accounts for nearly 25% of infections in the UK. In Scotland, Omicron has become the dominant variant and is responsible for more than half the cases there now. The UK government is advising citizens to restrict social gatherings.
It is sensible for people to cut down on work or other interactions with people, including potentially social ones, which are less important to them, so that they reduce their chances of catching COVID and indeed reduce their chances of passing it on.
The super mutant variant is also driving the COVID surge in Belgium and Denmark. Experts warn that Omicron can overtake Delta as the dominant variant in Denmark within 1 week. The United States of America, which reached the grim milestone of 800,000 COVID casualties, is bracing now for an Omicron wave.
It is the most transmissible virus of COVID that we had to deal with thus far. It has a doubling time of about 3 days. And if things go in the United States the way they've gone in other countries, and there's no reason to believe that that won't be the case, it will soon become dominant here.
World Health Organization has called the pace of the Omicron spread as unprecedented. The G7 has termed the crisis the biggest current threat to the world health sector. Back home, India has crossed 100 Omicron cases. The infections are reported from 11 states. So far, no community spread is seen.
अभी तक अधिकतर केस देश में जो आए हैं या तो ट्रैवल हिस्ट्री है या ट्रैवल से कांटेक्ट की हिस्ट्री है.
Advising caution, Health Ministry has laid 3 simple steps to prevent an Omicron surge. 1. Avoid non-essential travel. 2. Steer clear of mass gatherings. And observe low-intensity festivities this holiday season.
Omicron may not be the driver of the current pandemic situation in India, but it could slowly lead to a surge in cases as we move from winter towards next year. India certainly can't afford to lower its guard at this moment. Milan Sharma for India Today.
Okay, let's then raise the first big question on the Omicron Global Doctors Roundtable. Is a new wave inevitable in India and across the world? That's the first big question that I want to raise. And let me take that to you, Dr. Chetty, because you are there in South Africa where it all began. Do you believe that what South Africa is going through today, what the United Kingdom is going through today, the rest of the world inevitably will go through tomorrow a sudden surge in Omicron cases?
Yes, I think that's correct. Omicron is far more contagious than any of the other variants that have been around so far. So I expect that it will spread around the globe very, very quickly. However, it is a milder form of illness, even though more contagious. So it has the potential to displace the pre-existent variants in different countries. So being far more contagious, I expect it to spread. All it takes is one case, and that's going to start to spread amongst people in that country.
Can I just ask you to elaborate for our Indian viewers your South African experience over the last, over a couple of weeks with Omicron? What have you seen in terms of vulnerable groups and more?
Well, what we've noticed is that initially Omicron was affecting the younger age groups below 40, but that has changed. We're starting to see older people get infected now with this new variant. It does cause very mild illness. We're seeing patients presenting with symptoms, the commonest being headaches and fatigue. Some patients are having gastrointestinal symptoms and generalized body aches and pains. There isn't the upper respiratory presentation we saw with the other variants. The hypersensitivity that occurs on the 8th day is far milder. I think that's expected with the change mutation in the spike protein itself. So we're having very mild illness. The one thing that I've noticed amongst the patients I've seen so far is that vaccinated patients seem to be at higher risk of picking this up. We can't call the subset unvaccinated anymore because a lot of them have already had corona infection and so have recovered from corona without taking a vaccine. So we have a level of herd immunity amongst that unvaccinated population. But clearly, the vaccines have shown no benefit in preventing this Omicron variant. And so I'm seeing a lot of vaccinated patients presenting with the illness with this variant.
Very significant what you've just told us. That a number of patients that you're seeing in South Africa at the moment are those who are presumably, you're saying, double vaccinated. Despite the vaccinations, they are getting Omicron. The good news, mild symptoms. The not so good news, vaccination is not a defense. Dr. Gautam, let's come to the United Kingdom, which has over the last few days become the epicenter of Omicron. We are seeing a surge in cases, the highest number in a single day caseload, both in the United Kingdom and, dare I say, neighboring France. What is it about the United Kingdom that has made it so vulnerable to Omicron, given that so many people there are double vaccinated?
Thanks, Rajdeep. I just wanted to say that in the last 18 months, I've participated in a number of media interactions related to COVID. And around the summertime this year, I really hoped I would not be doing this again. But unfortunately, here we are talking about the new variant once again. So it's an unfortunate situation. We have come to a point where the new variant, Omicron, as you said, has just exploded. And more so in the Western world at this stage. You're right in asking the question, why UK? I think it has happened before with a number of variants in the past. The UK seemed to get hit right at the beginning. And I think it's perhaps something to do with the demographics of the population. At the moment, obviously, we are seeing a significant increase in number of Omicron cases. What's going to be more challenging for the UK is the Delta variant has not really died down fully. The Delta epidemic is still here. The curve is just, instead of a curve, it has been flat. And it's still there. What Omicron has done, on top of that, it has presented in the form of another epidemic. So essentially, there are two epidemics going around in the UK, Delta plus Omicron, unfortunately.
And is it fair to say, Dr. Gautam, that most of those who are getting infected with Omicron are those who previously either had COVID infections or certainly are double vaccinated? So it is a reinfection in most cases?
So if you just look at the UK data, we really don't know much at this stage. There are about 15 to 20 patients who are confirmed with Omicron in hospitals. So we really need up to 300 patients to get any meaningful data. However, based on the preliminary studies conducted in other countries, South Africa, I think the pattern seems to be the same. A double vaccination is not having a huge impact in prevention of Omicron, but the booster vaccination seems to be doing the job to some extent. But as I said, we do not have any UK data to confirm that. And obviously that is relevant because UK population is slightly different from the South African population. So it could go in our favor, but at the same time, it may not go in our favor. But we'll just have to wait for another couple of weeks to get that data.
But already
we are relying on what we have seen in other parts of the world so far, and therefore the booster program has been extended on a massive scale.
I'll come, Dr. Gautam, to the booster program a little later. But I want to come to you, Dr. Srinath Reddy. From what you've heard from the experience in South Africa, where it was first detected, now in the United Kingdom, where it is spreading, there are those like the UK Chief Medical Advisor, Chris Whitty, who are saying that it is going to peak incredibly fast and it is doubling at a very fast pace. What's your sense, Dr. Reddy? How worried should India be with Omicron at the moment, given what we are seeing in the United Kingdom and South Africa?
Well, the fact that it has entered India, it's been detected in different places, is a signal that it is very much with us and is likely to rise in numbers. What the consequences are in terms of illness and in terms of the stress on the health system is what needs to be watched. Clearly, it appears to be a less virulent virus, but far more infectious, and it's going to infect a large number of people. It is likely that having acquired some amount of immunity from the Delta during the horrendous second wave, and also with some level of vaccination, both the first dose exceeding 82% and the second dose exceeding 50%, it is likely that there would be some defense against serious illness and hospitalization and death. However, the question is, are the number of infected persons going to rise? Very likely, because as we have heard, even vaccines which are systemic vaccines are not able to prevent infection per se, though they prevent serious illness and death. And even if the virulence is low, if very large numbers are infected, then we will expect some stress on the health system. Just to give a little idea of what the numbers might be, if you're talking about one person getting very serious illness out of 10,000 people, that will mean 100 people in the hospital. But if it is the same 1% in a million people, that will mean 10,000 people in the hospital. So we'll have to be wary of what it does in terms of overall numbers. But in general, this promises to be a milder virus for most people.
But are you saying, Dr. Reddy, therefore there is an inevitability that it will result in some kind of a wave, potentially in January, February, as some doctors are suggesting in this country?
Well, the virus has entered India and it is likely to spread. We will have to take our best precautions, and the best precautions are wearing masks, not having large crowds, and ensuring that as far as possible, we follow all the precautionary measures of COVID-appropriate behavior, because vaccines do not prevent infection, they prevent serious illness. But masks, distancing, and ventilation prevent infections.
But is a wave inevitable? Sorry to press this. In your view as an epidemiologist, is a wave of a kind that we saw in this country in April, May during the second wave inevitable? Or do you believe even if the numbers increase, unlike Delta, it will not cause that kind of damage?
Well, my general belief is that we will see an increase in the numbers of people who are infected. If you define a wave by the number of people who are diagnosed to have the infection, yes, there's likely to be a wave. On the other hand, if you're talking about a wave in terms of serious people crashing into hospitals and into intensive care, then we may not have a severe wave. And it is our best efforts we must make to prevent that from happening.
Let's turn to Mumbai for a moment. Dr. Rahul Pandit, you're a member of Maharashtra's COVID-19 task force, and we've seen that Maharashtra usually is where it all starts. It happened with the first and second wave. Out of the total 77 cases as of Thursday morning, Maharashtra had reported 32 of them. Is there a fear that there could be a surge? Because it appears that Maharashtra government appears to be particularly worried about the Omicron effect. You're putting in a lot of security steps in place.
Good evening, Rajdeep. Look, I think we are very, very concerned. There is no doubt about that. And we want to make sure that we want to stay ahead of the virus this time and take every precaution possible so that we could avoid a spread to the larger extent. But having listened to the South African as well as the UK colleague and having reading the papers about the cases increasing in both of these countries exponentially, I do fear that once the virus is in the country, all it takes is one case and you would probably have the cases increasing. What we need to concentrate on is how are we going to minimize the spread, and obviously vaccination. We will discuss boosters as we come to that, but masking and ventilation need to be the very, very important cornerstones for this. Another aspect which we need to understand is, which was very well highlighted by the speaker before, is about the percentage of patients. I might just take that one notch ahead. Even if we say that the mortality with Omicron is only 0.1%, if 1 million people are going to be infected, it's going to be 1,000 people who are going to basically die because of that. So I think we should not take this lightly. All this discussion that it's a milder variety is absolutely fine in terms of statistics, but when it comes to life, we need to save every life, and we need to hone that to everyone, that the only way to save yourself is not to get infected. So wear a mask, be in a ventilated place, and do the appropriate thing of taking your vaccine when time comes for that.
Let's turn that therefore to this whole notion. Are Omicron symptoms too mild for the world to be worried? That's my second question. Are Omicron symptoms too mild for the world to be really worried about Omicron? Let's take that question about symptoms being mild to you, Dr. Chetty. You said that in all the cases that you've dealt with at the moment, most of them are very mild. Should we therefore treat it just as a common cough cold? In a way, this is the way in which nature perhaps will provide us with antibodies without sending us to hospitals. Why should there be so much of alarm if the symptoms are very mild?
I think we need to be cautiously optimistic. From looking at the symptoms of Omicron, we're getting very mild illness. If you look at the hospitalizations now, hospitals randomly have to test every patient that comes in. 80% of the patients in hospital with Omicron were incidentally tested, and they're there for other reasons. So Omicron and this variant really doesn't result in any severe illness hospitalizations, or far less than the previous variants. So that's a reason to be optimistic. However, we are also dealing with a change in spike protein, and spike protein is the pathogen of COVID illness. And so we need to be cautious of any long-term effects from this viral infection. So I think that is where the caution needs to be, that we need to examine these patients for at least a few months after they've recovered from Omicron to make sure that there are no lingering or long-term side effects from the virus, this new variant itself. But from the perspective of optimism, Omicron is a milder variant, a far milder variant than we've seen before. Right. So it provides us with almost a God-given live attenuated vaccine. So people that get this variant will have mild illness, but will come out of it the other end with a broad natural immunity. So Omicron will supersede the immunity that it will give to its host compared to a vaccination. So vaccinations at this point in time have to take a little bit of a back burner, in that they're not going to be as effective in curbing the spread. After all, they prevent severe illness and death. But Omicron does not cause severe illness and death. So we've got to weigh the vaccine side effects against any benefit it might give us. So I think rushing off to give booster doses to an entire population might be nonsensical. But there is reason for cautious optimism. Okay. Omicron can displace the more virulent variants in countries, create mild illness. Yes, it will spread very quickly. And even if we have a few hospitalizations, that can overwhelm the hospital's setup simply because of the speed at which it spreads. But I think with the more contagious, milder variant, there is reason to be optimistic for the future.
Dr. Gautam, then why is the United Kingdom panicked? In the last few days, it appears there's a sense of panic in the United Kingdom. Look at the statements that are coming out of the United Kingdom. They seem to suggest to me that the United Kingdom is very worried that this could spread in a manner that it goes out of control. Is that simply fear of what happened with Delta repeating with Omicron? It's not based on Omicron per se, but based more on the UK's experience with Delta, that you all are panicking, it appears, in the manner that the UK is at the moment.
Yeah, Rajdeep, you're right. I think there is a bit of a state of panic, and I think for the right reasons. The way Omicron is behaving in the UK is nothing compared to Delta. The trends are actually suggesting in the next couple of weeks, it could lead to up to 1 million infections per day. So yes, it's reassuring to know from the colleagues around the world and whatever studies we have, however small, that the symptoms appear to be mild. But what's going to cause a big challenge in the UK is the sheer number of cases, not the severity itself. So, for example, if you have 100 mild cases, one certain percentage of patients do end up in hospital. So out of 110 were ending up in hospitals. So instead of that, if you have 1,000 patients, so the people attending hospitals is certainly going to increase. So having a definite amount of resources, i.e. NHS in the UK, what the country is worried about, whether the system is able to cope with a sheer number of cases, and there is a danger of overwhelming NHS with that. Okay, so that's a reason for panic. What we have seen with Delta was nothing compared to what's coming our way in the next 4 to 6 weeks, unfortunately.
Just in terms, this is presumably though, just in terms of the sheer numbers. Dr. Pandit, when you hear that the United Kingdom fears that hospitals could get overwhelmed over the next 4 to 6 weeks, how prepared is India, or dare I say Mumbai, where you are with the Maharashtra task force, to handle that compared to where we were 6 months ago when Delta hit us?
So certainly there have been a lot of learnings from the Delta variant, and we have been very keenly following up the updates from South Africa and UK right now. We have kept the machinery up on a trigger position where if we need to increase our COVID beds, which includes our COVID care centers as well as hospitals beds, it will definitely be very, very quick to ramp up that situation. But what I am worried about, Rajdeep, is that currently a sizable number of patients are coming into the hospital for non-COVID work. And that's where my fear is, that if the hospitals are going to be filled up with the COVID variant, and then these patients who are actually seeking help for non-COVID work, where are they going to be fitting up? And that's when the system will be overwhelmed. And we don't want a situation like what happened in the first wave, where the non-COVID patients almost stopped coming to the hospitals. They sat on their illness for months together, and then were presenting with sudden cardiac emergencies or strokes or orthopedic surgeries, which should have been done a few weeks ago, were sort of postponed because of fear to come to the hospital. I think that's the real fear which I have, that we need to be able to cater to both group of patients, because right now they are there in the system, and that's where the hospitals are full with non-COVID work.
But Dr. Pandit, if the symptoms are mild, why worry? If the symptoms are mild, as we are being told in South Africa, as to a large extent as of now in the United Kingdom, why worry?
Even if we look at, say, 3 or 4 lakh patients per day in India, what we saw in the peak of Delta, and if that's going to be around 5% of them going to need admission, we can do the mathematics. It's going to be at least 25,000 people who would require admission a day. And that's where the worry is. It's the sheer number at which it increases and how quickly it increases. Right. If Delta gave us 3 weeks to reach to that number, this might give us only a week to reach to that number. That's where the concern is.
Okay. Just to press you one last time, does Mumbai have the kind of capacity to handle a surge like this?
At the moment, we are prepared, and we are looking at increasing the capacity as well. I think the Bombay Municipal Corporation is working overtime to try and identify what more could be done in terms of number of beds if we need to increase it.
Okay, let's come to the next question, and I want to bring you in, Dr. Reddy, on this, because it's a question that's being asked about boosters. It's going to set up a huge debate, And at the moment, the government isn't giving us enough clarity on whether they're going to go ahead with boosters for to meet future challenges within the next 2 months. Do you believe, and this is the question we are posing, do booster doses offer any real immunity against Omicron? Given the fact that the vaccines don't seem to be offering complete immunity, do you believe the time has come that those who've been double vaccinated should get boosters now? Dr. Reddy, should boosters be given? Is this the right time to offer a booster as immunity against Omicron?
Before I answer the booster question, may I also come in on the previous question that you posed?
Please do.
About getting overwhelmed.
Yes.
Actually, if the cases are mild, we should really focus on detecting them early and managing them at home early. Home care is the way to go, and not let people crash into hospitals and occupy beds, which will actually deny other people who need hospitalization the requisite care. Even during the peak of the Delta wave, or when it was actually hitting us fairly hard in May, we, along with Deloitte, the Public Health Foundation of India, partnered the government of Haryana in Karnal and showed how home care can actually be effectively performed by ASHAs, auxiliary nurse midwives, and other frontline health workers with the help of telemedicine and telehealth facilities monitoring. Right. That greatly reduced the pressure on the hospitals. And with much milder Omicron, we ought to really use our primary healthcare facilities much better in order to promote effective home care rather than let hospitals be overloaded with cases which do not require that amount of monitoring. As far as the boosters are concerned, yes, the vaccines may not be able to completely overcome this variant, which is actually showing a great capacity for vaccine-induced immunity effect, which is being evaded by this variant. However, I believe that people who are very vulnerable, the elderly, the immunocompromised, and those who are likely to have high repetitive exposure to high viral loads, like healthcare workers looking after patients, and a number of patients at that, would actually benefit from boosters with a certain amount of enhancement of immunity. But it's not a prescription for the larger population in general.
No, let me just press you. Are you saying, therefore, that you first would like India to reach a certain level of double vaccinated population, 80 to 85% adult, before we go into boosters, or start boosters for those who are vulnerable? And presumably by booster, you mean a different vaccine to the vaccines you've used, not Covishield, not Covaxin, but possibly Novavax or an mRNA vaccine. mRNA is not available in India at the moment.
Well, mRNA is not proven to be very effective against this variant in any case. Viral subunit protein vaccine may help a bit, but I would go ahead with firstly vaccinating the people who still need to be vaccinated with the double doses and providing as much immunity to people as possible. And if we are really talking about a heterologous booster using a different vaccine rather than the first one, then I think we probably will have to go in for the viral subunit protein vaccine, which is going to be produced in India itself. So I think that is where we probably will have to really find.
But the worry, of course, is that there is this waiting period. And I want to get your sense, Dr. Chetty, from what you're seeing in South Africa. Are the boosters working? Are mRNA boosters, is Pfizer working? Are there particular vaccines that are working as boosters against Omicron?
I've seen in the third and now in the fourth wave, people that are fully vaccinated getting breakthrough infections. So the mRNA vaccines are very narrow in their ability to stimulate antibodies. And that narrow band of antibodies for the specific wild-type spike protein does not protect sufficiently for the new variants. And a lot of the new variants have changes in their spike protein, which then makes the vaccine that you've got old hat, and it's not going to be able to curtail any infection. However, that being said, the aim is to get to herd immunity. Clearly, the vaccinations have not got us there simply because of the narrow of immunity that they provide, and they do not cover any of the new variants. Now, going down that road and trying to develop new vaccines for every new variant is going to have us chasing our tails. However, we have a natural infection here with Omicron that is actually mild. So like the previous speaker said, our focus should be on early treatment to prevent hospitalizations. That is very simply done with early outpatient treatment. And if we do that, we can use that to actually curtail the stress that will be put onto the tertiary health services. So early treatment is vital. Now, if Omicron is allowed to spread cautiously through a community, when that community recovers, they would have developed a broad natural immunity, which will be cross-reactive with other variants itself. So I think that Omicron can give us the herd immunity that we require. However, with vaccinated patients, we are still not sure when they have breakthrough infections, whether they develop a robust immune response. And if not, will be prone to repeat infections. So we got to be cautious about leaning on vaccines or boosters when we're having a surge. If we got a vaccine that hasn't actually protected us, then I think Omicron needs to be a little bit of wait and see, rather than a knee-jerk reaction to go through boosters when we know of side effects but are unsure of any efficacy it might provide us, seeing that Omicron is a mild infection.
Very interesting. You're saying that you need to be a little cautious before you rush into with boosters. But Dr. Gautam, in the United States, we are actually, in the United Kingdom where you are, we're actually seeing health policy makers pushing ahead with boosters. People who have got double vaccinated are going ahead with booster doses in the hope that that will be a sufficient check on Omicron.
Yeah, Rajdeep, that is correct. And I think we have to remember that for even the first and second dose of vaccine, they may not prevent getting infection, but certainly reduction in hospital admission does happen secondary to first and second dose administration. And
so why is the UK pushing? Sorry, why is the UK then pushing ahead at the moment with boosters? If, as Dr. Chetty is suggesting, that one should be very cautious, allow perhaps the natural course of Omicron to run, why is the United Kingdom pushing ahead with boosters?
So the reason to push ahead with the booster is all of a sudden the goalpost has shifted, Rajdeep. The finish line has shifted. If we carry on going in our car with the same speed and same acceleration, we are going to fail. So this is the time we go in our sports mode. And therefore, the booster vaccination, which has shown some hope that it will prevent people getting infection. And that is the only hope we have to reach the finish line. Even with the booster vaccination, we may not be able to, the way Omicron is behaving at the moment. So we do have the option of not doing anything. But that would be equivalent to sitting in your car going with the same speed and knowing you are definitely going to fail.
Dr. Chetty, you want to respond?
Options we have, that seems to be the best one at the moment.
They're interesting. United Kingdom seems to be going ahead with the booster program. South Africa, much more cautious. India doesn't have the option at the moment. You want to respond, Dr. Chetty, quickly? Do you think the UK has panicked too early?
I think we have. This has been a joke with my patients from the start of COVID. I think that almost every patient on this planet at some point is going to get a COVID infection. It's a respiratory virus that we can't ignore and we can't avoid. So the joke with my patients has been that you're going to get COVID, choose your variant very carefully. And where we're sitting with now is we have a mild variant, and I think it provides us an opportunity. If we vaccinate with boosters to try and avoid this infection, then yes, people might not get infected. We might have the curtailment of severe illness when Omicron is actually a mild variant. And if you do not get this Omicron variant, the next variant might be far more severe as far as its ability to cause mortality and morbidity. And so we might have missed a trick. So vaccinating our way out of this is never going to be a way to curtail this pandemic. I think that herd immunity is what's important here. And so if Omicron is providing us a mild illness, then trying to avoid it might bring us into contact with the most severe variant in the future and put our lives at far greater risk. So I think we mustn't miss a trick. Omicron's milder, and we should watch it very closely and allow it to run its course with the measures that we have in place to prevent it spreading rampantly and overwhelming services.
Very fascinating how South Africa and Dr. Chetty are putting it. Allow Omicron to run its course. But you seem to be supporting, therefore, the notion that herd immunity alone will eventually stop this pandemic from continuously, in some way, transforming through various variants. But which brings me to my next question. If there are some who are saying, be careful, cautious with booster doses, as South Africa is suggesting, if not booster doses, what else can stop the virus spread? And that's the question, Dr. Pandit. There's talk now of finding other ways in which to stop the spread of the virus. There's even hope that there will be a pill that will be available soon, which could ensure that at least you're not hospitalized. Dr. Pandit, how confident are you that there could be solutions that ensure that we don't get hospitalized at least this time?
So I think India is on a little bit of a different ground here. If we look at our hybrid immunity, which has been there in our community, I think it's very difficult to predict which way we will be going. Mm-hmm. But coming back to your question, which you asked, that what are the different ways? I think principally COVID appropriate behavior and ventilation, which is masking and ventilation, giving yourself cross ventilation in closed spaces if you can, and trying to remain outdoors as much as you can with the mask is the only short way, along with the help of vaccines, to keep yourself out of the hospital. The pills are there are tablets which are coming, but I really doubt the efficacy. With every new paper, the efficacy of tablets has been dropping down. We looked at the Merck tablet, the molnupiravir, which has now gone down the efficacy to almost 30%. Well, they may probably give you some amount of hope and relief if taken early, but most of these antiviral medications seems to work, if they work, within the first 48 to 72 hours from onset of symptoms. So that's going to be the key. Identify these patients early, and if you can give them. And another factor which is going to cost is going to be the cost in India. How much are they going to cost us? Will we be able to provide it as a public health initiative for everyone who is getting infected? I think these are difficult questions to answer, Rajdeep, right now, unless we have the complete data in public domain about these tablets, as well as the cost, which is going to cost us.
Dr. Reddy, it's coming back to what you said, focus on healthcare, home care, but can we medicate our way, Dr. Reddy, out of an Omicron possible wave that sets in over the next 2 months?
Well, I'm not so sure. Of course, the antiviral pills, for example, Paxlovid, which basically the Pfizer drug, Paxlovid, which they're really talking about, they claim about 89% efficacy in the first 3 days and 88% in the 4th and 5th day. But still, we have to really look at the data and see how effective it's going to be. But getting people...
Because just to intervene, sorry to intervene, Pfizer says that if given within 3 days of the onset of symptoms, Paxlovid reduces the risk of hospitalization and death by 89%. So Pfizer is claiming that these new pills for COVID treatment will spell hope. Do you believe that it's too early to judge that? And they're not available in India?
No, firstly, it's too early to judge that. And secondly, that also means that many people will have to report themselves as having symptoms and get tested early in time.
Right.
Apart from the fact that this has to be available widespread for distribution all across the country. So I'm not going to pin my hope entirely on that. I would rather hope that with adequate public health measures, we slow down the transmission and do not allow the hospitals to be hit hard, and particularly if we focus on home care for the fairly mild symptoms. But if the viral pills do prove effective, they may be useful in some cases, and we may not necessarily have to depend upon distributing viral pills to every household.
Okay, let's turn to one final question that I have. In phase 1, when the virus hit, there was a harsh lockdown. In phase 2, we had oxygen shortages and other predicaments, and people were struggling to cope up with the spread or the virulence of Delta. What should we do this time, God forbid, if Omicron hits us? Are harsh measures going to be required is the question I want to raise. Or, as Dr. Gautam, should we now cut out all Christmas and New Year parties? Is that being advised across the United Kingdom? Can the UK afford a second year without any Christmas being celebrated?
Unfortunately, Rajdeep, yes, that is the right thing to do. As I said, it's all of a sudden the goalpost for the UK has been shifted. So that would be the right thing to do. Having a complete lockdown, we are in a very different situation than we were in the past. There are different medications available, however, may not be equally effective as they were in the past. The population vaccination rate is higher, and the complete lockdown may just prolong the epidemic. I think the investment really should be not only for the UK, every country is to find ways how to live with variants. It's going to happen. There will be new variants.
No, sure.
So in addition to vaccination, the focus should be the measures for every industry. So masks should be norm of life, social distancing, and making every industry on the planet safe so that we can function in a socially distanced manner and improving ventilation of the infrastructure. Okay. I think this is where we need to find ways to learn with the new variants. It's going to happen again, unfortunately.
You know, Dr. Pandit, I'm coming to Mumbai for a wedding. The wedding is indoors, hopefully within 200 people. But do you believe that there needs to be a cutback, Dr. Pandit, once again, that we can't celebrate New Year's in Mumbai or indeed any part of the country with large gatherings? Is that going to be the message that you're sending out?
Absolutely, Rajdeep. I think we have to be very, very cautious in these times. While Omicron has not really spread into the city or the country right now into the extent in which it has in the other two countries we are discussing about right now, currently, but this caution needs to be exercised, and we have to be very, very clear what we want. We want to live with the virus and continue doing our normal work. We want to celebrate in small groups if we can. Does not mean that it may not spread into small groups, but at least it remains limited to that small group, doesn't have to spread across to a larger community very quickly. Right. I think that's the message we need to be very, very clear about.
So no large gatherings in Mumbai in the month of December is the hope?
Yes.
Okay, interesting. In South Africa, Dr. Chetty, is Christmas going to be celebrated in a large way, or is there going to be a cutback again? Because as Dr. Gautam said, the goalposts have changed once again.
I think we need to review the efficacy of our measures so far, and of course take our opportunities where we can. What we've seen in South Africa is that lockdowns, isolation, that kind of thing really hasn't brought the necessary flattening of the curve like we wanted from the start to any of the countries that have instituted them. However, outdoor gatherings have shown to be a very minor source of spread. Indoor gatherings, different. The virus spreads a lot more quickly indoors. So in South Africa itself, people are well advised to socially distance, wear a mask, protect yourself with sanitizing. If you're going to have gatherings, try and ensure that they're outdoors with people that you know. That would curb the spread of the variant itself. But remember that coronavirus is something we as human beings will live with. And there's absolutely no reason for us to eliminate it from our environment. It will lead to becoming endemic. It has other animal hosts, other vertebrate hosts, and we can't vaccinate our way out of this. So coronavirus will become more contagious, but it will become less pathogenic. And in doing so, it will become an endemic virus that gives us nothing more than the common flu. However, if we keep testing people that are asymptomatic, we're going to be hyping up fear. We should be more concerned with illness, and in that, severe illness or hospitalizations. So I think testing needs now to be limited to those patients that are either ill or require hospitalizations. So there's no point telling us that we have 20,000 new cases today when only 1,000 of them are actually ill from the infection itself. So I think we need to change the way we report our case numbers, and we need to start to be moving towards reopening society very cautiously as this virus slowly moves to endemicity. If we keep vaccinating, we might start to force the variants to change into more pathogenic variants, and that can be a disaster.
Fascinating, because I think what you've done is summed up in a way, and because this was detected in South Africa, it's interesting to have a South African guest. Don't fear Omicron. Learn in a way to live with it. Focus on illness. Just don't focus on the big case numbers. Target the illnesses and in a way slowly open up to live with the variant. Yes, there is a variant around the corner, but do not panic or create a fear, create fear mongering as was done at times, and that can be dangerous. So I think you all have given us a sense of what lies ahead. One final question that I also had last week, and maybe Dr. Reddy, you want to resolve this. I don't know, is it Omicron, Omicron? Do we have any clue what's the right way to pronounce it, Dr. Reddy?
Well, there has been a lot of debate. I really do not know. The British probably pronounce it differently and the Americans pronounce it differently. But I suppose we'll have to go with Omicron. And I think it's more the virus variant we have to worry about rather than the variation in the pronunciation.
Very good. How do you pronounce it in South Africa, Dr. Chetty?
We pronounce it Omicron. Variation in pronunciation for a variant.
Okay. Yes, Dr. Reddy, you wanted to say something? 30 seconds only.
No travel bans, please. That is irrational. Traveler surveillance, yes, but no travel bans.
Okay. I think that's very well put again. No travel bans, travel surveillance, yes, and also keep down the rates of RT-PCR tests across our airports. Don't profiteer out of this holiday season, certainly. To all my guests, you've shared your wisdom once again. It's always good to have doctors because it is truly then news and information and knowledge without the noise. Thank you all very much for joining us. You out there, stay well, stay safe. Thanks for watching. Bye for now.